two questions. How can we help you? Okay. We are a group that has taught toward this exam almost 30 years now. And although that may sound strange that we have been teaching medical school by teaching people to do well on the exam, it has to be our basic principle that this is a very clever exam. Okay, it's not just torture, it's actually cleverly constructed to test you for your ability with important clinical skills. Now, skills in knowledge of the basic sciences, but we are convinced as a group of faculty that doing well on this exam and doing it properly makes you a better physician. Okay? Now, there's a difference between having a book to read and actually having a teacher. And I thought I would illustrate in my personal evolution as a teacher that as I teach immunology, this was the diagram that I began with almost 30 years ago. If you notice, it's black and white. It's an algorithm talking about B cells and T cells and antigen-presenting cells and so forth. But this is not a diagram that would help me as a physician to think through the process of the immune response in a human being. So as I moved into my current evolution, realize that what I have done in my notes, and this is my newest, what I call my nirvana diagram, that will be going into my new notes that I'm currently developing with Medical School Companion. I'm not going to beat you with this. We're going to have another webinar in a week if you guys want to see how nirvana actually works. But despite the color and the complexity of this, what I wanted you to see is that as I teach this now, as I understand what a physician needs to understand, I have overlaid my diagrams on the surface of the anatomy of where things are happening. So the concept of where an immune response is actually happening in your patient becomes a critical point for you to be able to think about why they would have a symptom or a sign of something happening in that area. Of the anatomical basis of the immune response is huge. And the second thing that I don't think you get often from books without teachers is a concept of the timing, which I also try to build into all of my discussions. Because the things that are going to happen immediately when you have an injury are going to be very different than the things that happen once I have had days to weeks to experience this invader, whatever it is, and make an adaptive immune response to it. So the point is not that my diagrams have gotten very colorful and so forth. The point is that I now teach the immune response based on my understanding of what a physician needs to practically understand about how the immune response in their patient will work. So as we go through materials in online classes, as we will be working with MOKSH here for you students if you sign up, you'll notice that we slant our discussions of individual topics by thinking about what a physician needs out of that topic in order to be a good practicing physician, okay? We teach you to study to completeness. I showed you patient to molecular. We teach you how to organize all of that memorizing that you've done over the past sequence of years. We teach you to understand the clinical disease process and the natural history of each disease. Because remember, one of the first questions that a patient is going to ask you after you've given them their diagnosis is, what are the next steps if this disease continues in the way it has? Can we interrupt it and make you better? Or is this an inevitable progression to a next step? These are all extremely important conversations that each and every one of you will need to have with your patients. We give you a problem-solving strategy We work through questions in class and talk through exactly how to approach them, using clinical reasoning for the management of what tests you would order, what you would learn from those tests, etc. And all of this sort of mounts up to give you a feeling of confidence that the day in the Prometric Center, although it will be nerve-wracking and exhausting by definition, it will still give you a feeling that you've not moved into absolute shrieking panic mode as you've gone, because you've done it before, you have a strategy for managing a problem, and you're simply going to settle in to the routine of going through this as if, as I said, it's another day in the office. So that is all I had prepared to talk about, but I'm happy to open it up to questions, and we'll let Shirag pick out some of your questions and hopefully get most of them answered. I will hope to see you in an online class here with MOKSH if you can. And in the meantime, they will send things to me if you have questions that don't get answered in class. Shirag?
Sure, ma'am. Absolutely. So, question here is, asked by Adarsh and Muskan. I mean, what they are trying to, what I understand, it's more of the weekly schedule. So, according to Muskan Khan, she's asking ideally how many subjects in a week should I study and how to manage. Adarsh is asking medical school curriculum and USMLE preparation because he feels it's little hectic.
Hectic is absolutely the middle name of every medical student I've ever met. So in the first place, you simply have to accept that as being the rest of your life. That's probably not a very satisfying answer. However, I think you're going to have to find a balance for yourself between what you're doing in medical school, what you need to do for your sanity and your family and everything else in your life, and what you can accomplish in the way you study. And so my answer is not going to be very precise because each and every one of you is going to have a slightly different situation. And again, I would try not to compare to what someone else is doing. You know, you may be in medical school with someone who is leaving medical school classes and tells you that they're doing 3 blocks of questions every day in preparation for the USMLE. That is not normal. And I would argue that listening to that person tell you that is simply going to make you feel inferior and more nervous. So I think you have to work into everyday schedule. You've got to have good meals. Your nutrition is important. Your sleep is important. Your exercise is important. All of these things have to be done. And I think the best approach while you're juggling with medical school is to not be too hard on yourself about what you think you can accomplish in a given day. Because once again, if you think about the process of preparing for this exam as a marathon rather than a sprint, it's not the speed at which you get across the finish line, it's the fact that you make it on your 2 feet. So focus on that far goal of crossing the finish line, and then don't beat yourself up if once or twice a week you simply say, my brain is full. I've got to take a break. I've got to go out and watch a movie. I've got to do something with my life because I simply can't do this or I'm going to explode. That time you take off to decompress is arguably every bit as valuable as continuing to study, because you reach a point of saturation emotionally and intellectually and you just can't do it. But I can't tell you individually because I don't know you yet. It's going to be something where you're going to have to ask yourself, okay? I think probably Jawitz is the one that is most commonly used. It's pretty much at the medical student level. It's not PhD level microbiology, but it's good clinical thinking, and there's a lot of memorization. Other things that students use for my field, because of course there's lots of memorization, is something called sketchy microbiology, and there are sketchy versions of most subjects. What they are is help to remember by drawing cartoons and giving you funny ideas of how to link concepts together. So if you have trouble with memorization, you might look at one of those. There's also another one that's called clinical microbiology, made ridiculously simple. And ridiculously simple always sounds good, right? Again, sort of humorous, cartoons, ideas of how to memorize. But those are the ones that most of my students in the US have used. What you have to do is the same thing that you would do if you were training to run a marathon. You have to work up to it incrementally, and every new month that you start, try to increase the length of time that you sit and concentrate. There's no easy way to do it. I think if you can work yourself up during your study to the point of probably making 5 or 6 hours at a time of intense concentration, that you'll find on exam day that the difference between that 5 hours and 8 hours or 6 hours and 8 hours, that's going to be made up by adrenaline, okay? So you probably don't need to be running a marathon every day, but certainly in the final weeks of your preparation, you need to be practicing sitting and concentrating fully for that length of time, and it's not easy. You will find that this is probably the most exhausting day of your life when you take your exam because of the nervous tension and everything else. And you simply have to try to mimic the process that you'll be going through on exam day and recreate that as you study. But keep in mind that the step 1 exam focuses on the principles of basic science. So if you wait too long before you take it, you'll find that you have become rusty in the molecular details because you've been spending your time working on the clinical practice of management of disease. So generally, I think as close as you can to the finishing of your basic science years, you're going to find that that material is still fresh in your mind and probably much more easy for you to brush up a little bit and get that score you want. I certainly know people who would do it at all different levels, so it's not that it's impossible at any level. It just, if you think about that same continuum from Garrod to Osler, you're deep in the weeds in the first few years of the molecular basis of disease. And as you switch over into your clinical years, you're losing some of the edge that you had from that stuff before. So as close as you can to your basic science years, with the understanding that life gets in the way sometimes. Again, if I were doing this for myself, and I guess the closest thing I can tell you is having tried to help my children, I think that you actually need some sort of an expert of what's important and what's not important, okay? So it would certainly be important to have a complete and deep understanding of any of the heavily observed diseases in the United States. So, right at the moment, we have got obesity, we have got diabetes, and we've got heart disease. So just with that trifecta, you better be able to explain absolutely everything in detail that could happen to a patient with one or all 3 of those diseases simultaneously, okay? Then, if you think about, in my field, the epidemiology of infectious disease, then you would want to have a deep and comprehensive understanding of the most common of the bugs. Okay, 95% of all hospital isolates in the United States on a given day are staph or strep. And so you better be able to explain everything about those two organisms, okay? But there are other organisms that will show up on the exam in a minor way, and the only way that I know that a student would know which are the ones that are heavily tested versus not is either to use first aid, because those are what students saw, or to have a course like ours where we specialize in telling students what are the things that are most heavily tested. Other than that, I understand your conundrum of reading things and thinking that everything is important, but they're going to test you on the most common, most dangerous, and most actively diagnosed in the United States. So, for example, parasites in general and tropical medicine are not heavily tested. A variety of different viruses that don't occur in the United States are not heavily tested, and so forth. If I were going to do it, I would either use first aid as a roadmap if I didn't have a chance to take a course, or I would sign up for a course that's taught by experts who have been doing this for years. Okay.